Good morning, everyone. I'm really honored to stand up here and share with you our experience of working in this field of integrative medicine. And I think this event is great in that three organizations come together. I think during this event, we'll have a lot of exchanges that will cross-pollinize our field and generate new collaborations and new projects and new knowledge. So I'm very happy to be here and thank Helene to organize this whole thing. I'm going to talk about the overview of integrative oncology. And then I'll introduce some of the clinical work or clinical practice, what it's like in practicing integrative oncology, and also some of the research that's going on in the field. And we'll hear a lot more about specific data research later in the day. And I'll touch a little bit on educational activities and overall where the field is going in the next stage of development. So as we know, this whole field of integrative medicine came from patients' interest in using some of the unconventional therapies that were not part of traditional mainstream medicine, including herbal remedies, acupuncture, meditation, and so on. A lot of them came from Eastern origin, but they have a long history and tradition. There are lots of empiric experiences and information, but there are not a lot of scientific research until in the last 10 years or 20 years or so. So in the last 10, 20 years, there's an explosion of research and scientific studies in this field. In this background, a lot of patients are interested in using them. On the other hand, these therapies can help them, and some of them may also do harm unless they're under professional guidance. So many patients are using it on their own because of the current regulatory environment. And by several surveys, on average, there are about 40% of the US population would use these therapies. In cancer patients, it's even higher, between 50 to 60, 70%, depending on the surveys. In this context, a lot of patients are using it for not only reducing symptoms, but also to help their cancer treatment. In the past, we will probably kind of dismiss that idea, but I think research in the last 10 years, in a way, strengthened this holistic approach to health. Because this is a slide shown about 10 years ago, back in 2000, our understanding of cancer cells is mainly focused on cancer cells themselves, how they grow out of control, how they stop dying when they're supposed to go apoptosis and so on. So all the chemotherapy, radiation, and so on focus on stop the cancer cells from growing. However, in the last 10 years or so, the research shows the cancer cells actually interact with the rest of the body, with the environment in a very intimate way, so that when you change the environment where the cancer cells live in our body, you may be able to change the behavior of these cells, how they grow, how they die, how they spread. And some of the examples are, for example, let me see. First of all, how the cells use nutrients, how they use glucose, glutamine, amino acids to support their growth and metabolism, the energetics, and how the cells will avoid immune reaction, immune pressure, and how they interact with the immune system in the body, and how the inflammation, local inflammation from chronic wear and tears in the body may promote cell growth and tumor formation, and also the overall environment the cells live in. Do they destabilize the genome so the cancer cells undergo more mutations and become more malignant? So all these are emerging hallmarks of cancer cells. In the last 10 years or so, a lot of therapies, mainstream therapies, are developed to interfere with these aspect of cancer cells. For example, hormone therapy to block the estrogen that gives cancer cells stimulants, or a lot of immune therapy developed in the last 5 years or so that actually work quite well. So when you look at this, we start to see some of the so-called unconventional therapies, because they do focus on the holistic, on the whole body in the holistic approach. They actually can influence and change the microenvironment and also the macroenvironment these cells live in. And by doing that, we may be able to influence how cells behave. We don't have definitive data on that, but there are a lot of animal data or preclinical data suggesting this is actually what's happening in our body. And here is just another example. By changing, oops, how do I go back? Okay, so this is a very simplified version of the cancer cell's microenvironment. You see the cancer cell interact with a lot with the stroma, which is related to connective tissue and fascia, the immune system, how the blood vessel goes in. We know there are studies showing if under stress, you promote angiogenesis. Adrenaline will stimulate angiogenesis to supply nutrients to the cells. And there are a lot of growth factors involved, pro-inflammatory cytokines, insulin, IGF. They're all under the influence of how we eat, how we deal with our body every day. So in that context, we think the integrated medicine model, or integrated oncology model, is like this. We see cancer cells live in an environment in our body, and our body is under the control of our mind. We all have spiritual needs. Outside of us, we have family and friends and society, and also the physical environment in general. All of these, if we can optimize and make them as nurturing as possible to us, we may be able to get the best outcome in cancer treatment. So in a simple word, integrated medicine, that's why we call it integrative, because we want to integrate everything we do to our body, to our mind, and reduce symptoms, hopefully also promote survival and reduce recurrence. So under this model, how do we optimize the micro and macro environment? We want to first start with awareness and mindfulness, because without awareness and mindfulness, nothing will happen. Patients have to be aware there are a lot of things they can do that can help them, and they can do it at home. They can do a lot of self-help under the guidance of doctors, but the doctor's job is really to inspire and empower the patients, inspire them to do something and empower them by giving them the tools to do. And the specific things we can do are nutrition, because whatever we eat creates this metabolic environment in the body where the cells are bathed in, and that may stimulate them to grow or tell them not to grow. And exercise, stress management, proper sleep is very important, circadian cycle. These are things that in the past was overlooked, perhaps by a lot of healthcare professionals, but I think in Eastern medicine system, all the Eastern medicine, Ayurvedic, Chinese medicine, Korean medicine, there are a lot of focus on the circadian rhythm, right, on the day-night cycle, what you do at what time. So now there are molecular biology studies showing there are certain genes in the cells that are related to this biological clock, and when you influence that, you may change the behavior of cancer cells. So in addition, physical environment, more importantly, joy and laughter. Do we, when we talk to our patients, did you do something fun today? Did you laugh today? That's very important, and a lot of them it's a reflection of their mental health and spiritual health, loving relationships and the meaning and spirituality. So you can see this is a very, very noble and high goal. We try to achieve that. Sometimes we cannot, but at least this is the goal we set for ourselves, trying to achieve. In this way, our body will be more like a tree that's taking all the nutrients and energy from the environment, the healthy environment, and thrive and become the strongest possible. So that is what we see integrated oncologists like. It's not just about using herbs or supplements or using a specific modality. It's to incorporate all of them together to nurture the body, make it the strongest possible. With that, over the last 10, 20 years, many cancer centers established integrated medicine programs. Almost all the major cancer centers, like Sloan Kettering Cancer Center, MD Anderson, Dana-Farber, Columbia, Harvard, Yale, and Duke, and so on, University of Pennsylvania. On the West Coast, UCLA, UCSF. Most of them have the integrated medicine component, and they are very popular among the cancer patients, and there's a strong demand from patients. On the other hand, there are also some barriers in the delivery of this care, because the care model in integrated oncology is a little bit different from how our current medical system is set up, because you have to spend a lot of time talking to patients. You have to do a lot of hand-holding and teach them some of the techniques. A lot of these things may not be reimbursed by insurance companies, although things has changed in the last few years because a lot of insurance companies now cover acupuncture treatment. I would say 15 years ago, they probably didn't. So there are a lot of programs around the country, and I think most of them share something in common. The clinical practice, the clinical service we provide yearly have several components. One is physician consultation. Oftentimes patients come in, they want to explore herbs, supplements, acupuncture, yoga, meditation, but some of the oncologists or mainstream doctors, they were not trained in their medical school in residency, so they cannot say with confidence, this will help you or this will hurt you. So they tend to refer these people to integrated medicine service in their institution. And when physicians approach them, we take that as an opportunity to educate them. We not only just answer the specific question on specific herbs and supplements, we also want to do an evaluation of their health, overall health in their own psycho-social, cultural environment. And then we formulate a more comprehensive healthcare management plan. A lot of that focus on nutrition, diet, what you eat and how you eat, how you live your daily routines, exercise, how to reduce stress, and how to promote good sleep, and then selective and judicious use of natural products, including herbs and supplements. And all of that the goal is to make patients become self-sufficient in taking better care of themselves. Because a lot of people, they just go on their daily life without thinking about their own health. However, a diagnosis of cancer really get them going. We have many patients who are smoking, they try to quit many times, never successful. The second day they're diagnosed with lung cancer, they quit. So diagnosis of cancer, sometimes we can use it as a way to change people's life and make them get on the road of a better health. In addition, we offer nutritional counseling, which tend to focus on specific patients' needs. In most patients, we need to tell them healthy eating habit on disease prevention and health maintenance. For people who are undergoing active treatment, radiation, chemo, they don't eat well, they throw up, we need to keep their weight, and we teach them ways to improve oral intake, appetite, digestion, and so on. And this is where a lot of Oriental medicine have a lot to offer, because improving digestive health, either using acupuncture or certain natural products or herbal formulation, can be quite helpful. And gain weight for people who are cachectic, and lose weight in patients who are overweight. Because, for example, breast cancer patients, after treatment, 80% of them actually gain weight, and being overweight is a risk factor for recurrence. So it's important to help them control their weight. Mind-body therapy is critically important. It will also benefit not only patients, but also healthcare professionals, because healthcare profession is a high-stress profession. All of us can use some of these techniques to reduce stress. And the specific measures of meditation, guided imagery, certain kind of breathing exercises, so on, to improve anxiety, stress, sleep, depression, and so on. Acupuncture is also another holistic approach, because when we do acupuncture, we just don't, if you have headache, we just put needle in your head, right? You have joint pain, just put needle in your joint, around the joint, because it takes a holistic approach to health by regulating the traditional theories, the energy flow. There are lots of neuroscience research recently showing we can modulate the neurological reaction to biological processes. So acupuncture, especially in the cancer care setting, has been studied extensively. We're going to hear more about the data, especially on pain and nausea, vomiting. There are many randomized controlled trials conducted in these areas. There are other, for example, dry mouth, hot flushes, anxiety, insomnia, digestive tract dysfunction, lymphedema, fatigue, neuropathy. All these are being studied and a lot of data are being generated. Massage is very relevant to our conference here. By manipulating the musculoskeletal system, especially the connective tissue, fascia, we may induce certain kind of biological changes. There's a variety of techniques, and Swedish massage, reflexology, shiatsu, tuina, Reiki. You may say Reiki should not be qualified as massage, but Ayurvedic massage. But they all share something in common, which is by changing the body, by using outside forces, we may induce some biological changes that is of benefit to patients. Music therapy is very important, especially in the palliative care setting. And you can play music to patients or ask patients to play, or you can teach them how to compose. Especially for end-of-life patients, we use that a lot. It brings comfort and joy, ease fear, and also enhance self-expression, and also lessen this feeling of isolation and loneliness, and give them a sense of closure, because music can really touch our heart, our soul in a very profound way that no language can do. So music therapy is very helpful in the palliative care setting also. Exercise and physical activity, we all know in the last few years, many strong research suggesting not only they improve people's strength, quality of life, they may also lend to survival benefit in patients who exercise regularly, especially cancer comparing with those who are sedentary. And we usually advise them on the general aerobic exercise, and we're going to hear more later today about other forms of exercise, like resistance exercise and so on. And also specific exercise regimen for patients who are recovering from treatment, like after mastectomy, thoracotomy. There are certain ways of teach them how to move. And many of these techniques originated from like yoga or Tai Chi or other Eastern modalities. And Tai Chi yoga is very popular among our patients' population. So that's basically the clinical aspect, practical aspect, but we also want to practice evidence-based medicine, so we always look at the evidence. And if you look at the PubMed publications from 1980 to now, there's an explosion in the last 10 years or so of the number of papers published on meditation, acupuncture, herbal therapies, or yoga treatment. And out of this proliferation of research data, we were able to generate certain kind of practice guidelines that not only we feel comfortable, but also the mainstream practicing oncologists will feel comfortable in recommending some of these therapies to their patients, because they feel this is already thoroughly researched, and the benefit clearly outweigh the risk for some of these modalities for certain indications. And here are just some of the example of the high quality research that has been done. This is a meta-analysis published in JAMA last year, summarizing acupuncture for chronic pain. The totality of data suggests they are better than usual care, and also slightly better than placebo sham, because that's always a question about acupuncture research. For nausea, vomiting, this is a much older paper, but the meta-analysis shows it helps chemo-induced nausea, vomiting. And massage treatment, mainly to help mood and the pain, improvement in those symptoms. And yoga, there are a lot of studies on yoga, randomized controlled study as well, on anxiety, depression, quality of life, fatigue, and so on, of variable effect size. And here's a more recent one showing yoga and meditation together using both mind and also body-based therapy can reduce menopausal symptoms in breast cancer survivors, because these patients have very few treatment options. You cannot give them hormone replacement, or if you give them antidepressant, they have lots of side effects. So these are very good addition to the treatment options we can offer. Not only they reduce treatment symptoms, they also actually improve the general health of these patients. So when you see some of these endpoints, you'll see they have fact B, the physical, social, emotional, functional benefits. Based on these studies, we're able to generate a summary of research data and offer guidance to doctors practicing in the community using an evidence-based way to generate these clinical practice guidelines. This is the NIH Clinical Practice Guideline Clearinghouse in oncology setting. The people working in this field generate 3 guidelines in general for lung cancer, also in general, and most recently breast cancer patients. And so I encourage you guys to look up, especially the most recent one. It's a very thorough, systematic review of thousands of papers and very strong in this evidence base. Because of that, all the research and done in the last decades, the whole field has changed, and we have progressed a lot since 2000. This is a Joint Commission's pain management standard revision. So starting at the beginning of 2015, they said, Joint Commission is the body that accredited hospital. They inspect the hospital. If you don't meet their standard, you cannot operate. So they are a very powerful organization. And they said for pain management, you also not only you can give people drugs, morphine, opiates, you also need to incorporate non-pharmacological strategies, including acupuncture, massage treatment, relaxation therapies. So as you can see, we have come a long way in the last 10 years. Now it's part of recommended standard practice in the operation of a hospital. And that also opened up a big field for those of us who work in this field, acupuncturists, massage therapies. A lot of hospitals may start to incorporate that in their regular care. It has not happened as quickly as we would like to see, but it is happening. And there are also lots of educational activity in the field. I'll just use the example of Sloan Kettering and show some of the activities. Physician clinical, we have a physician clinical training program. We also have, these are people who actually come to us, do observership or longer time shadowing patients than doctors. Online courses for physicians, for nurses, for acupuncture, massage treatments, elective rotations. We have collaboration with Cornell University, Columbia, NYU, and their nurse practitioners also come to us for preceptorship, and there are lots of high school students, college, medical students. These educational activities are important because we need to educate the younger generation of healthcare professionals. So first of all, they are very open to this approach to health. Their mind is open. They're interested, they're curious, but if we can introduce this approach to health to them early in their career, maybe we can change their trajectory and generate more people working the field and elevate the whole level of the field in the future. In addition, we try to summarize all the research data on herbs and supplements and make it publicly available. This is a website we developed showing about 270 and growing number of herbs and supplements that are commonly asked by cancer patients. These are literature's narrative summary of all the data, side effects, constituents, and mechanism of action we know about these herbs like ginseng, graviola, or others. And there's also a web app people can download for free. There are times that we got more hits on this website than the Sloan Kettering homepage, which shows the tremendous interest in the population. And not only we want to do things the way I described, we also want to incorporate them into the regular care of cancer treatment, because that's the only way the field can go forward and to the next level, is to better incorporation. So we call it integrative medicine. And we work closely with palliative care, cancer medicine, survivorship, employee health and wellness, behavior science, rehab, and so on. Actually, 95% of our patients are referred by our oncologist, which shows that this approach is actually quite well accepted by the practicing oncologist. So in summary, we think integrative medicine can enhance cancer care in several ways. For patients, it reduces symptoms, but that's the first step. the next step is to improve, promote self-care, because we all know self-care is very important, enhance quality of life, and also nurtures the well-being of body, mind, and spirit. And most importantly, to me at least, we want to make these patients ambassadors of healthy lifestyle, and they spread the message to their families and friends. Because we have many patients, once they change their behavior, they can influence how their kids eat, because childhood obesity is getting worse and worse. But when we teach the parents, you can influence how they feed their kids, and also all the other healthy lifestyle changes. So we can spread the message and make health contagious and spread it to the whole population. Not only for patients, it has benefit. Integrated medicine also benefits a lot of cancer care professionals, because when we teach patients these techniques, we have to practice ourselves. Otherwise, we have to practice what we preach. And by doing that, we also develop, we get benefit in our own life. We become a healthier person, both in body and mind, and also in the way how we enjoy our work. And by healing the healers and improve the wellness, we become better, more effective healthcare professionals. So we try to show our employees how to remain strong, how to reduce stress, and how to stay well in many ways, working in collaboration with the employee wellness and health program in our cancer center. When a healthcare professional become a more effective professional, they can really strengthen the relationship with patients. I think those of you who see patients every day, you already know that in general, for example, acupuncturists, they tend to have a very good relationship with their patients, because there's such a close, intimate understanding of what acupuncturists can do, not only for their symptoms but also for their life. The bottom line is all of these will improve the overall quality of care to cancer patients. And that is what our missions are, and all the cancer centers' missions, and all the people who work in this field. So we have come a long way since 2000. At that time, a lot of the key questions are how many people are using this, right? Because at that time, if you look at all the papers they published about the CAM usage, how many % are using that? And also, do they work? And also, which one works? Does acupuncture work? Does massage work? And I think we have passed that stage in many fronts. And at this time, I think we're at this junction that we can go further and do more ask more in-depth questions about mechanism, personalization, and also clinical impact. And how do they work? So we're going to hear a lot about this in this conference, and the underlying mechanism of action that's explained in modern scientific language. In whom it works, we know there are polymorphism among us, genetic polymorphism, so they respond differently to certain treatment, like chemotherapy. If you have a mutation, you respond. You don't respond. But I think for a lot of these therapy, acupuncture or meditation, there may also be a difference among individuals that can be personalized once we tease out the critical elements. And by knowing more about these therapies, we can make them work better, and how we optimize the treatment, individualize it, so we get the best effect size to people who are likely to respond, meanwhile not wasting patients' time and energy and resources on things that it's not going to benefit them. And last, but also very importantly, how to integrate all we do into the regular clinical practice in the general hospital or the community, and improve cancer care in general. Because we can do all we want to do, but if we are separate, we are outside of the regular healthcare system, we're not going to make as much impact as we want to make. So to me, I think this whole field is very exciting. I count myself fortunate working in this field for the last 12 years. And I see we're at a stage, a lot of things are going up. And this is a picture I took about in 2012 in Albuquerque. They have an International Balloon Festival. The Society for Integrative Oncology held their annual meeting there, and we all went to see this. It's a once in a lifetime experience. I think I suggest you all go there if you have a chance. You can see hundreds of balloons going up. And to me, doing integrative medicine is very much like riding a balloon because doing Western medicine is more like an airplane from point A to point B, the fastest, quickest, shortest way. You get there fast. But a lot of these therapy we're doing, they're more gentle, they're more natural. And balloon has no power. All you have to do is to harness the power of the nature and use the wind and heat and get to where you want to be. Maybe we're going there more slowly than the other way, but I think the journey is much more enjoyable. And I think for both our patients or for us, we all get a lot of benefits from doing this. Thank you all very much.